Folks are probably familiar with what 911 is, right? You call 911 in case of an emergency, 311 for city information, when's my trash going to be picked up? Well, you call 211 for information related to community resources, places that help with rent, local food pantries, maybe a local community clinic. The pandemic definitely put a spotlight on 211. We saw this huge surge of calls, so some 211's getting volumes, 3 times as much as they've gotten in the past.
With 211, we can take thousands of calls per day and quickly meet the needs of clients. But in a way, you're kind of triaging those calls and you're identifying callers that might need a little bit more. They're calling because their most immediate need is, I need to get a roof over me and my child's head. But then when you have a conversation, you realize that the reason why they're not able to really afford stable housing is because they can't afford the childcare in order to work. And we see 211 as that access point where we can get them connected over to our platform, Connect ATX, to then really have that larger conversation and get them connected to resources. And through the platform, we're actually able to track that person.
We are in the process of building out what we call closed loop referral relationships with social service providers in our area that allow us to both ensure that the caller or online user that we're working with is actually connected with resources. And if not, to collect really good data about what that gap is so that we can communicate it to policymakers, planners, funders. That is an essential part of this work.
We work with hospitals, health plans, state government agencies, as well as the community-based organizations across the country to make sure folks are able to find and connect to services simply with dignity and ease. We know that our 211 partners in the field have a similar vision, and so we see a really exciting opportunity to partner together. 211 has that human component that folks often need when they're finding their way through the bewildering social service landscape. And with that connective tissue underneath, we could really start to build toward more deeper relationships with callers, track what happens once the call ends. And so really start to envision a world where we're moving beyond just simple transactional interaction towards more relational, ongoing, outcome-based support.